Hello, everyone. Welcome to our branch series discussing clinical trials and research in inflammatory bowel disease. I'm Dr. Aline Charabaty, Associate Professor of Medicine at Johns Hopkins School of Medicine and founder of Monday Night IBD. I'm joined today by my colleague and friend, Dr. Jana Hashash. She is an Associate Professor of Medicine at Mayo Clinic in Jacksonville, Florida. Jana, welcome.
Hi, Aline. Thanks so much for inviting me.
Absolutely. I am so excited that you are here with us today. For everyone, this is a branch series that is CME certified and jointly provided by Global Education Group and Bonum CE. These activities are supported by an educational grant from Janssen, AbbVie, and Takeda. Our disclosures are shown on the screen. If you haven't already completed our pre-activity survey, please do so by clicking the link below or by scanning the QR code shown here. Let us know who you are, and don't forget to complete your evaluation at the end of the session to claim your CME credits. And of course, follow Monday Night IBD and Bonum CE and set your alert notification for more CME certified programs. Jana, I am very excited to have you today to talk about the role of the physician scientist in IBD. For the longest time, we separated the researchers who did the science, the labs, the trials, and the clinician who applied the result of the research into their practice. And then the relationship was often flowing in one direction from researcher to clinician. But the physician scientist is really in a unique position to identify patients' unmet needs and use their clinical experience to guide the research and ask the right questions or the right scientific question to help improve our understanding of the disease and how to improve the care of patients with IBD. Can you tell us how your clinical practice guided or influenced your research and research interests?
Thank you, Aline. I truly feel very fortunate to be in a position where I can see patients in the clinic and firsthand identify areas from practice that need more advancements and identify questions that need to be answered, and then be able to take this back to the lab or to our clinical research team and try to find solutions and answers to these questions. We're truly fortunate to be able to help care for our patients. And I really believe that we're in a strategic position to use our clinical knowledge base, experience, and expertise to complement our research skills to provide the best answers and try to move the field forward. It's without a doubt that my clinical practice greatly influenced and continues to influence my research focus and areas of interest. As you know, before moving to Jacksonville, I studied and practiced at the University of Pittsburgh, which is home for one of the largest and most prominent liver transplant centers. As such, many of the patients who I saw had concomitant PSC, primary sclerosing cholangitis. And this really drew me to study PSC and PSC IBD overlap with a goal to find a way to improve the outcomes of patients suffering from these conditions.
Jana, this is truly fascinating. And I think it speaks to a few things here when you're developing a clinical research interest. Look at what is around you, what kind of other specialists are in your institution, your practice, what are your patient needs. And also, it's interesting that you pointed out that trying to answer one clinical research question led you to understanding other research scientific questions. So one thing leading to another, but really use what is available to you at your institution and or at your practice. So with that in mind, how do you take that question, that scientific question, that research interest from a pilot grant to a fully funded grant to grow your research impact?
Thank you. I think securing successful research funding requires several key components. Perseverance is key in these situations. You have to keep applying, don't give up, and keep applying. When we talk about the researcher, of course, being passionate about the idea, the concept, research itself, being committed and knowledgeable, we really need to be very up to date with the topic that we're studying, be creative, and at the same time, stay as focused as you can. Strengthen yourself, try to learn clinical research techniques, get a master's degree if you're able to, learn if you're doing immunology research, learn more about immunology, depending on what the area of focus is. The team also is extremely, extremely important. Oftentimes you have more than one mentor. You need people with the clinical expertise, clinical experience. You also need someone with a scientific expertise. So for my translational research project, I have a clinical mentor. I have a more basic science mentor. We work together in order to answer this question in the best manner possible. One of the most important things is also to have fun and enjoy what you're doing. Make sure it's what you want to do and not what someone else wants you to do. Meaning, if you're not passionate about this, it's going to feel like a waste of time. But if you really like it, you're going to have fun. You're not going to lose interest. You're going to just be encouraged and be driven. So have fun and enjoy it, as you apply and hopefully get funded.
So, like you pointed out a little bit, the researcher is very important, but there's a whole research team supporting you. What are the key elements to build an effective research team?
So, of course, the investigator is very important. That's the researcher. The mentorship team is extremely important. And having a research coordinator is critical for the success of the project. One of my mentors used to say, the research coordinator is the quarterback for that project. We're clinicians, we're seeing patients in clinic, but you have to have someone who is fully dedicated to that single project, who's looking out patient recruitment, following the patient, make sure everybody is in check. Most of what I do requires a multidisciplinary team. So I have co-investigators, whether it's from hematology, from cancer biology, different expertise that are going to bring different things to the project and move it in the right direction. Of course, many of my projects, almost all of them, I work very closely with a statistician and I involve them early on so that they tell me, they make sure that my study is powered, they make sure that we are on track and that our results are going to be meaningful at the end.
Jana, you talked about finding the right mentors and collaborators within your institution, but also I presume sometimes you look for these mentors and collaborators outside the institution to widen your reach, your research reach, but also you might not find the right person in your institution. How do you select those mentors and collaborators?
Finding the right mentor requires you to identify someone who can guide you and support you and also critique your project in a positive manner to help move it forward. For a research mentor, this person really definitely has to have the expertise to provide valuable insights to your work. Like I mentioned, the mentor needs to provide constructive feedback to you. Nowadays, picking a mentor is, I think, easier than before because we have more access on the internet to all the research papers that are published, social media. This person is doing this kind of research. So, if it aligns with what you're doing, you can reach out to them. You can email them, even if they're outside your institution. I personally have mentors in different countries also. Picking a mentor who has achieved what you aspire to achieve one day is important, as your mentor can really share advice on what made the journey successful. How can it be easier for you? Warn you about the pitfalls, problems that they experienced.
Jana, we talked about how you find your niche by you're really focusing on your own patient unmet need and what is available at your institution, developing a research team, finding mentors and collaborators. But the most important step in any trials is that we have to enroll patients. So how do you approach the topic of clinical trial to your patients in your practice?
Of course, after I finish speaking to the patient, when we're going over the plan and what we recommend, if we have a research trial, clinical trial that they may be eligible for, I introduce the research topic to them, gauge their interest. So many people want to learn more about that research project. A lot of times I honestly tell them there's no need to commit right now. They can go home and read more about the pamphlets because the last thing I want is for someone to feel pressured that this is what, we're driving them in one direction, because at the end of the day, it's a voluntary trial. And before they leave, if they're interested, then I ask my research coordinator to come and speak to them more about the trial itself, give them all the information that is needed, and if need be, schedule another visit with them to discuss more about this trial itself.
Absolutely. So it's a process, right? It's a process. It's a conversation. It's not, you have to sign here and commit. which brings the patient, being comfortable being part of the trial. And I feel like there are some patients that feel not only that this trial will bring them benefit for themselves, but also they really want to help advance the care of IBD in general. So I want to conclude things. Maybe you talked about the fun of research and how you have to keep the fun in it. But, I know that many researchers face a lot of barriers and challenges as they're writing the grant, getting them, approved. The IRB process can be brutal. I know I had trauma from IRB. So how do you overcome these challenges, and especially in this current environment where funding might become more scarce?
Aline, I completely agree with you. It is a fun process, and of course, we're all very passionate about it, and that's why we do it. But it's also challenging, and we do struggle sometimes. After doing this for several years now, I can tell you for sure that time is the most precious commodity. And it is extremely difficult to get your time supported or covered. And this brings me back to what I said earlier. You just have to apply anything that your research project may fit to this, RFA. Go ahead and apply. Be creative. If the needs of your institution are to fund stem cells, try to kind of see how you can apply stem cells to your patients. If your institution wants to fund preventing cancer, check to see in IBD which patients develop cancer and how you can help that group of patients. And by getting time, of course, the money will follow. Most of the times most of the grants do come with some money, but the most important thing is to try to protect yourself in order to think, write, analyze, meet with collaborators, read, but really most importantly, think about the problem and how to solve it.
Jana, thank you again for being with us today and for all your insight on how to be the best physician scientist we can be for our patients with IBD. Keep the passion alive, be perseverant. There are challenges ahead. Educate yourself on how to be the best researcher you can be. Surround yourself with a supportive team that can help you lead the project to the final line and to success. Find your mentors, your collaborators, talk to your research coordinator, your statistician as you're developing your project, and get the buy-in of your institution so you can have a dedicated time for your research, and that your clinical question is thoughtful, is impactful, and use the resources that you have available to you, whether it's other specialty focus, whether it's institutional grants available, professional GI society, industry, NIH grants. See what is out there and how these kind of grants can help you answer your questions and help your patient live a better life with inflammatory bowel disease. So thank you everyone for joining us today. Thank you, Jana, for being with us today. Please make sure you claim your CME credit by completing the PUS survey and the evaluation form in the links below, or by checking the QR code shown here.